My name is Sarah Preston, and this is my presentation on HIV and AIDS. AIDS, or acquired immunodeficiency syndrome, is a chronic, life-threatening condition caused by HIV, or human immunodeficiency virus. HIV damages the immune system by killing CD4 cells. When the CD4 cell count drops below 200, the infection reaches the advanced stages of HIV, which is known as AIDS. There are about 1.1 million people in the U.S. that have HIV, and 1 in 7 don't know they have it and need to get tested. It is estimated that 38,000 new HIV infections occur in the U.S. every year. During 2010 and 2017, the annual number of new HIV diagnoses in the U.S. decreased by 9%. HIV is transmitted through unprotected sexual activity, contact with infected blood, sharing needles, and from mother to child through childbirth, and can also be transmitted mother to child through breastfeeding. HIV attacks CD4 cells, causing the immune system to be compromised and the person to be at a higher risk to certain forms of cancer and infections that do not usually make the average person sick. CD4 cells are white blood cells that fight infection. The more you have, the better. The normal range for CD4 cells is 500 to 1500. Two to 4 weeks after being infected, you will experience flu-like symptoms, such as a fever, chills, a rash, night sweats, sore throat, and muscle aches. After these symptoms pass, many people do not see any symptoms for up to 15 years. If left untreated, HIV can progress to AIDS, which has symptoms such as rapid weight loss, recurring fever or profuse night sweats, extreme tiredness, prolonged swelling of the lymph glands, diarrhea, sores, pneumonia, red, brown, pink, or purplish blotches on or under the skin, memory loss, depression, and other neurological disorders. Because the initial symptoms are similar to a virus, many people ignore them and don't get tested. This continues the spread of HIV. This disease is chronic and left untreated can be deadly. Your immune system will be weakened and you are at risk to opportunistic diseases and some forms of cancer. To prevent the contraction of HIV, practice safe sex, and any needles you use should be sterile and untouched by anyone else. You should avoid all contact with others' blood and other bodily fluids. There are medicines available to treat HIV, such as Apivar and Biktarvy. There is no cure for AIDS, but early intervention using antiretroviral therapy can help with symptoms. In 2017, there were 5,698 deaths in the U.S. Deaths per 100,000 population is 1.7. HIV and AIDS can infect anyone, anywhere, so it is important to be safe in any situation. Human performance careers can be anywhere from health and wellness programs in professional sports to wellness in local gyms. Making sure to create a good cleaning process for any equipment and safe procedures for working with someone with HIV and AIDS are all ways to be safe in the human performance field. HIV/AIDS should not hold an athlete back. Anyone in the human performance field should create a safe environment for the person with HIV/AIDS since they are immunodeficient and for anyone working with or around them. These are my sources.